Mr. President, on a completely different subject, but related, we have lost 200,000 Americans to coronavirus. The predictions are that by Election Day, there could be 300,000 deaths, and by the first of next year, 400,000 deaths. My heart goes out to the families affected. I listen as spokespeople for the administration talk about the wonderful job that they've done in defending America from the coronavirus. The numbers don't back them up at all. The United States of America has 4.5% of the global population, 4.5%. And yet, as of this morning, we have 20% of the COVID-19 deaths in the world. 4.5% of the population, 20% of the COVID-19 deaths. This great and powerful nation, with the best doctors and hospitals and researchers and pharmaceutical companies in the world, has one of the worst records in fighting this virus in the world. It's sad to think you're 5 times more likely to be infected by COVID-19 in the United States than if you were living in Germany. Twice as likely to be infected by COVID-19 in the United States than if you were living in Canada. Canada, just across the border, has an infection rate half of what the United States has. What is it that they did that we didn't do? Well, they came together as a nation with a national policy, and it worked. We didn't. This president basically said to the governors, you're on your own. And as a consequence, there was this mad scramble to get protective equipment. There was this mad scramble for ventilators. It was a free-for-all, when it should have been a coordinated national policy. And then when the public health experts told us the obvious, that we ought to use these masks, that we should practice social distancing, wash our hands, avoid crowds, the President of the United States said just the opposite. One day he wore a mask. I saw on television when he visited a veterans hospital. I don't know if he's ever worn one before or since. When the message from the public health experts is this is the best way to break the back of this pandemic, this president mocked them by holding rallies across the United States with all of his loyal fans pointedly not wearing masks to show they really didn't care. Didn't care about any of the public health advice. And we're paying a price for it. More people are infected in this country than in Canada, at double the rate here over Canada, 5 times the rate over Germany, and so many more have died in this country who should be living today. The president at various times has said, when asked about the deaths, it is what it is. That's an off-the-cuff dismissal of the issue, which is beneath the dignity of any leader of either political party. Despite the urgent needs of families, businesses, workers, and unemployed Americans across the country, we haven't followed through on the original CARES Act, which passed in this chamber on March the 26th. It was that day that by a vote of 96-0 that Republicans and Democrats said we take this seriously, March 26th, and we're going to dedicate $3 trillion to making sure that we fight this virus and that we do everything in our power to cushion the shock of the economic impact of this virus on America. I went home after that and people said, I can't believe 96-0, Democrats and Republicans agreed. Well, we did. There were some proposals in there that were brand new. The Paycheck Protection Program that Senators Rubio and Cardin constructed, I think I've been told they spent perhaps 2 weeks in writing this important program. Was it perfect? By no means. We realized after a few weeks and months that it needed to be changed, and we changed it several times. But the concept was sound, to give money to small businesses so they could keep people on the payroll, pay their mortgage, pay their rent, pay their utilities. These are the fundamentals that a business needed so that it might reopen and put people back to work. It was a great program. It should be extended even further. I think there should be a second round. I also think there should be a second round when it comes to unemployment benefits. The $600 a week which we provided, which is incidentally subject to taxation, and people should remember, but the $600 a week which we provided over and above state benefits made a dramatic difference in the lives of Americans. Its critics from the outset said it's going to make people lazy. folks will just sit home watching Netflix and eating bonbons. Well, I don't believe that. In fact, when you look at the reality of the situation, 70% of the people who've gone back to work in America since the first of the year, 70% of them were earning less money at work than they did in unemployment benefits, and yet they went back to work. Why would they do that? If it was just about whether or not you're going to be lazy or thrifty, it's because they want to be back at work for the benefits, to do the work that they do and enjoy doing. And they knew that unemployment was a temporary thing, as it should be, as people have an opportunity to return. So that expired July 31st. The president has tried to extend it by executive order. There's question as to whether he has the authority to do that. The president's also trying to do something which I still don't understand to explain to anyone when it comes to the payroll tax. He is allowing employers to decide whether to suspend collection of the payroll tax to a later date. If that tax on your income of 6% or 7% is suspended, but yet you have to pay it all back in the first of the year, are Americans prepared to have a double taxation from their payroll check after the first of the year? And in the meantime, that payroll tax is supposed to be used to fund Social Security and Medicare. If the president is not funding Social Security and Medicare, what does that do to the solvency and longevity of those programs? It raises a question as to whether or not they're going to be hurt by this temporary measure. It's a very confusing proposal by the president, but he's put it on the table, and we're now trying to sort out the impact it's going to have. We need to do more here. We shouldn't go home from this election empty-handed when it comes to helping the families and businesses across this America. And we need to start with help for state and local governments. My state of Illinois has problems, plenty of them, when they come to pensions, for example. Just like Kentucky, we have problems funding our pensions in Illinois. But we have a second set of problems created by the pandemic, a downturn in revenue that is going to have a dramatic impact on the state budgets in Illinois and other states. If we don't help these state and local governments get through this problem, they have no choice but to lay off important, vital employees. Law enforcement, firefighting, healthcare, just to name a few. When people talk about defunding the police, I'm afraid that if we don't give a helping hand to state and local governments, we're actually going to see the defunding of some law enforcement across this country. So that's why those on this side of the aisle have been pushing for state and local assistance as part of any package of relief that we pass. The majority leader knows that this needs to be done. The playbook is right in front of him for another relief bill. We did it back in March with the CARES Act. To negotiate a real package with real solutions for the American people, the majority leader needs to show up at the negotiating table. Impossible to explain why Senator McConnell boycotted the negotiation sessions between the White House and Democratic leaders in Congress. There was an empty chair waiting for him, but he never filled it. I'm introducing legislation this week to help workers who have been furloughed or laid off during the pandemic from losing their health insurance. I can't imagine a worse situation in the midst of a public health crisis to lose your health insurance coverage. And if you've been laid off, your options are a few, but only a few. You may qualify for Medicaid, it's possible. You might go to the Affordable Care Act and go on the exchange and find an insurance policy that works for you and your family. But there's also an option called COBRA, where you would take the health insurance offered in your workplace and decide to keep it, but to pay the employer's share as well as the employee's share on premiums. The problem, of course, is it's very expensive. On average, COBRA costs $600 a month to keep the health insurance you had at work for an individual, $1,700 a month for a family. $600 a week sounds like a lot of money, times 4 weeks, $2,400. But if $1,700 a month is going just to maintain your health insurance from where you work, you can see that there's virtually no benefit. It is estimated that more than 23 million workers could lose health coverage during the course of this pandemic. That happens to just about mirror the number who were given health insurance under the Affordable Care Act. And now they stand to lose, at least the same number, stand to lose their health insurance because of the pandemic. Are we going to sit still for this, or are we going to help these families? My bill, which I'll be introducing with Senator Cortez Masto and others, would fully cover the cost of COBRA, enabling newly unemployed Americans to keep their health coverage during this difficult time. The legislation mirrors what passed in the HEROES Act in the House in May, 4 months ago. And it's vital to help those whose jobs have been taken away by the pandemic. We've waited 4 months to do something here in the Senate, and we've done nothing. Senator McConnell brought a bill up 2 weeks ago that was so thin and so wanting that it really didn't address the problems that this nation faces. But, Mr. President, there's a new report from the Robert Wood Johnson Foundation that half of Chicago households report having lost their jobs. Someone lost a job in a household, been furloughed, or seen reductions in wages or hours since the start of the pandemic. Half of Chicago's households reported facing serious financial problems during the pandemic and trouble caring for their children. 35% reporting that they've used up all or most of their savings. This is a terrible situation, a challenging situation. We owe it to this country and the people we represent not to ignore it. As we know, the pandemic has disproportionately affected our minority communities. Nearly 70% of Black families and 63% of Latinx families in Chicago report having serious financial problems. 70% of Black families, 63% of Latinx families. While those statistics reflect the reality of many in Chicago, there is little doubt that this is also the story in many other cities across this nation. That is why we need a federal response. We need to do what's necessary to help these families, businesses, cities, and states get back on their feet. But instead, the Senate Republicans proposed an inadequate partisan bill with no negotiations with the other side of the aisle that failed to prioritize the needs of the struggling Americans. The bills failed to provide another round of economic impact payments for families or hazard pay for essential workers. They failed to provide relief to states and local government to help teachers, EMTs, firefighters, and police. A week from Thursday is October 1st, which means another month's rent will be due, and many families know that they won't be able to pay it. We need help on a bipartisan basis. I agree with Federal Reserve Chairman Jerome Powell. If we don't move and move quickly to address this issue, the economy could sink even deeper and recovery be further in the distance. And in the meantime, the debt and deficit of the United States would be even worse.